My name is Joe Hendricks, and this is how we do it.
EVD placement. What is it? An external ventricular drain is a thin tube used to temporarily drain cerebrospinal fluid from the brain. Too much fluid in the brain due to an obstruction raises the pressure in and around the brain. An EVD helps to reduce pressure back to a safe level. Why is an EVD needed? Cerebrospinal fluid, or CSF, is a liquid that surrounds the brain and spinal cord. CSF is made by the cells in the brain's ventricles. The ventricles are large open structures lying deep inside the brain that transport CSF around the cranial cavity to protect the brain by keeping it buoyant and cushioned. Too much CSF can build up in the ventricles if the flow of fluid is blocked by a birth defect or an illness such as meningitis or bleeding. This is called hydrocephalus. Hydrocephalus increases pressure in the brain. Too much pressure in the brain can cause headaches, nausea, vomiting, confusion, loss of consciousness, and brain damage. An EVD drains some of the CSF or blood to restore a safe level of pressure in the brain. It also allows the healthcare team to record the brain pressure, also known as intracranial pressure. How does an EVD work? A healthcare provider puts a thin, flexible tube or catheter through the top of the skull into the center of the brain during a surgery or at bedside. The tube is attached to a pouch nearby. The tube drains the CSF fluid into the pouch. The amount of fluid is measured as it drains. The drain is also transduced to monitor the intracranial pressure of the brain. The EVD is left in place as long as needed. This may be several days, a week, or even longer. What are the risks of an EVD? All procedures have risks. The common risks of an EVD include difficulty placing the drain or misplacement of the drain, infection, too much bleeding or hemorrhage during placement or removal of the drain, a blood clot that obstructs the tube, excess fluid drainage, and dislodgement. What to expect during EVD placement? A neurosurgeon, neurosurgery resident, or an intensivist will perform the procedure. The procedure can be done in several ways. Please ask your healthcare provider to elaborate on the details of this procedure. In general, you can expect the following for your loved one. They will be given light sedation if it is done at bedside, or general anesthesia if it is completed in the OR. The medical team will also administer antibiotics during or after the procedure to help prevent infection. The healthcare team will shave the hair on top of the person's head, and the surgeon will make a small incision into the skin. Using a surgical drill, the surgeon drills a small hole into the skull, and will then make an incision into the layers covering the brain. The surgeon then places a thin tube into the incision and through the brain. In some cases, the surgeon may use computer-assisted imaging to help the tube reach the right place within the ventricles of the brain. The surgeon will then suture the skin of the scalp to hold the tube in place, and a sterile dressing is placed over the incision and the stitch. Finally, the surgeon connects the tube to the pouch. While your loved one has an EVD, the healthcare team will check the amount of fluid in the pouch hourly. While an EVD is in place, antibiotics may be given to help prevent infection. The CSF may also be sent to the lab regularly to test for signs of infection. Tell the healthcare team if your loved one has any worsening neurological symptoms such as nausea, vomiting, headache, altered mental status, or loss of consciousness.